Hi, I'm Mr. Tuwa. I'm doing my presentation on cord blood banking with David Delgado. We're going to be talking about what it is, the ethical issue, as well as the pros and cons that come along with it. So hopefully you'll be more informed.
Alright, so what is CBB? CBB is the storage of infants' umbilical cord blood and tissue for later use. Cord blood is known to contain potentially life-saving hematopoietic blood stem cells that offer advantages over bone marrow and peripheral stem cells. Now, when it comes to informing patients, specifically pregnant women, on CBB, it is important to ensure they receive comprehensive and needed information on CBB from their providers to raise the likelihood of appropriate choices being made according to Karaboyan. Now, with any patient, you always want to allow them to decide for themselves, as it is a big decision to go ahead with cord blood banking.
So the ethical issue that goes along with cord blood banking is that the American Academy of Pediatrics doesn't really promote using cord blood banking as a form of biological insurance for future diseases. And the reason for this is there isn't a lot of scientific data and research put into it to comfortably promote it to the public. And another big ethical issue is that the ideology of privatized blood banks versus publicized blood banks. And the difference between the two is that for public, it's free. You can donate it for use, research for other people's diseases. But for privatized blood banks, they try their best to make money off it. So a lot of families have to pay an annual fee so that they can save their blood for themselves. And there's a clear ethical issue with that.
So, just to reiterate what Jared said, CBB can be done through a public or private company. LifeBank and CryoCell are examples of privately run companies, and the costs that come with private CBBs vary and are based on the collection of blood, processing of the blood, and storing it for the families. But with public CBBs, there are usually no extra costs as they are accepting your newborn's blood as a donation. When it comes to private CBB, it allows for autologous and familial use of the stored cord blood stem cells, according to Carboyan. But for the public CBB, they provide stored cord blood stem cells to those who need it rather than for private use, according to Carboyan. So with this in mind, parents should also be aware that if they store their child's cord blood in a private CBB and later come to know that their child has leukemia, this will make the stored cord blood useless, as it contains pre-malignant cells and cannot be used to treat their child, according to Scheer.
So the cons that comes with cord blood banking is usually the price. It's about $1,500 to $2,500 depending on the privatized blood bank that you use, and there's usually an annual fee that comes along with it. And with that being said, it's cord blood banking is only useful when you need it, when there's a disease that occurs that requires it. And the statistic is that 1 in 200,000 people end up needing it. And on top of that, the viability is only 15 years. So after 15 years, it may not be viable for use at the end of the day. So the pros that come along with cord blood banking is that more people can receive stem cells a lot better than they can receive it from bone marrow because there's a less chance of rejection. And on top of that, it can assist not just the child, but a family member that may also need the stem cells, right? Because there doesn't need to be a compatibility there. And we spoke earlier about privatized blood banks, but the publicized blood banks are free. So the donation is also free, and it can be used not just for other diseases, but it can also be used for research. And through research, we can continue to promote it and improve it overall.
To end things off, this was our ethical presentation on cord blood banking. If you have any questions or wish to learn more about cord blood banking, feel free to look at our references/bibliography. We hope you found our presentation to be helpful towards your learning and studies. And thank you.